The Mpox outbreak in Africa is yet another example of how infectious diseases perceived to be someone else's problem and affecting mainly poor, developing countries may suddenly pose unexpected global threats. Mpox was discovered in 1958 in captive monkeys, hence the original misnomer monkeypox, and the first human case was identified in 1970. Then for decades, it was largely neglected by the scientific and public health communities, regarded as an uncommon infection in remote rural areas. What are the symptoms of Mpox, previously called monkeypox, and what does Mpox look like? Mpox symptoms may start 3 to 17 days after you are exposed. The time between when you are exposed and when you have symptoms is called the incubation period. Mpox symptoms last 2 to 4 weeks and may include fever, skin rash, swollen lymph nodes, headache, muscle aches and backaches, chills, tiredness. About 1 to 4 days after you begin having a fever, a skin rash starts. The Mpox virus spreads from person to person through direct contact with rashes, scabs or body fluids of a person with Mpox, extended close contact, more than 4 hours, with respiratory droplets from an infected person. This includes sexual contact, clothes, sheets, blankets or other materials that have been in contact with rashes or body fluids of an infected person. An infected pregnant person can spread the Mpox virus to a fetus, animal bites or scratches, wild game that is cooked food. Treatment for most people with Mpox is aimed at relieving symptoms. Care may include managing skin damage from the Mpox rash, drinking enough liquids to help keep stool soft, and pain management. If you have Mpox, isolate at home in a separate room. Mpox complications can include severe scars on the face, arm and legs, blindness, other infections, death. In rare cases, the type of Mpox virus spreading in the 2022 outbreak, called Clade II, rarely leads to death. Remember that Mpox is rare in the US and the Mpox virus doesn't spread easily between people without close contact. But if you have a new rash or any symptoms of Mpox, contact your healthcare professional.